Hi, I'm Dr. Aimie, and this is part 2 of the blog video on repairing the intestines after attachment trauma. So any kind of attachment trauma and trauma in general, anything that causes PTSD or chronic stress on the body, is a disease process that affects the brain and the body. In attachment trauma, it gets wired into the developing brain and body so that the trauma, the stress, those survival responses are wired in and stored in the nervous system. And mind you, this is the same nervous system that controls and manages all of your digestion and the whole digestive tract. So you're going to have digestive problems if you have a history of attachment trauma because of the ongoing effects in your nervous system. So how do we repair this? First of all, the most important thing is going to be to do the therapeutic attachment parenting. That, in the end, is going to be the biggest thing that you can do to calm down your child's nervous system and get them to a place where they are regulated and their nervous system is not all over the place and chaotic and going into stress and survival modes and throwing off the digestive tract. As you're doing the attachment therapeutic parenting, if you also work to repair their intestines, you can optimize their biology for doing that attachment work and make the healing process faster. So this is part 2 in how to repair the effects of trauma on the intestines. And there's 3 things we're going to look at today. One is going to be the food sensitivities. Second, we're going to look at gut motility. And third, we're going to look at the actual gut lining and repairing that. Let's jump in with the food sensitivities. Food sensitivities can be an immune system reaction or just a sensitivity that does not involve the immune system. For food sensitivities that involve the immune system, what's happening is that the body is actually making antibodies that attack the food. And this is the same immune system that attacks bacteria or viruses. And so it's a very important process, but sometimes when the nervous system is off and dysregulated, it can also go off track and it starts to attack things that it should not attack, like certain foods. And people with chronic stress and histories of trauma do have a higher propensity to have foods that they are sensitive to and have this immune reaction to. There are blood tests that you can do in order to find out which foods your body is actually making antibodies to. These will be important to completely eliminate from your child's diet for a period of time at least. There are also foods that don't cause an immune reaction but do have a sensitivity. And this sensitivity can be anything from just causing pain, causing changes in gut motility, whether constipation or loose stools, and taking those foods out of the diet for a time is going to play an important role in maintaining the best concentration, focus, brain chemistry, and as well as physical health for then being able to do the attachment work. This is all related to the gut-brain axis and how much in communication they are, and anything that's happening in the gut, especially if it's inflammation related, is going to be affecting the brain as well. So usually what happens is that if you can eliminate the foods that your body is having an immune system reaction to, and you'll know that through the blood test, you eliminate those foods, and then it becomes more obvious which foods are causing other types of reactions and sensitivities. Your child may not be aware of this just because they're usually so dissociated from how their body feels that they just immediately go into shutdown mode or anger, rage mode, rather than connecting the dots that, oh, my stomach is just actually hurting. And the other piece of the puzzle that we've talked about before is that any history of attachment trauma is going to make them more sensitive to pain, to gas, to stretching of the tissues in the intestines like inflammation will. And so while they are not aware of it, they are feeling very uncomfortable and usually then act out emotionally or behaviorally because of this. So as the parent, you're going to just start to become really aware of how their body and their mood and energy levels do after eating, and then start to track which foods seem to consistently cause the same reaction. You can look at the size of their belly, and if they've become really bloated, their stomach is really big, and maybe they're even gassy, maybe their gas smells really bad. All of those are indications that they ate something that does not agree with their body, that they're having some type of reaction to. Sometimes the reaction, again, is constipation or loose stools, and that may have a delay of several hours or even a day. And so tracking that will be really helpful to optimizing their intestines for the best brain health possible. And again, it's important to eliminate all foods that they're having any kind of reactions to, because this will offset their mood every single time they have that food. It will get better, and once they heal, usually they're able to tolerate these foods again without a problem. But until then, it's important to take them out of their diet. So second, let's look at gut motility. A lot of people with attachment traumas, insecure attachment style or attachment disorder, have issues with constipation, loose stools, even irritable bowel syndrome or inflammatory bowel diseases like Crohn's disease. And having a regular daily soft bowel movement is really important. And so until their nervous system does that naturally, we need to help them with that. So as parents, we need to be very aware of their bowel patterns and know, are they going every day? Are they having to strain? Do they sit on the toilet for a while? Or are they really loose and maybe even having stomach cramps because of it? If they are on the constipation side of things, the best thing that I have found to help is magnesium. Magnesium oxide is one of the best things if you're just trying to treat the constipation. But if you're also addressing just muscle tension and anxiety in general, you're going to use magnesium glycinate so you get both effects. Thirdly, we're going to look at repairing the intestinal wall. And the intestinal wall gets a lack of integrity due to the changes in the gut bacteria, as well as the overall irritation and inflammation being caused by food sensitivities. And what this means is that while it should be a wall that nothing passes through except just the digested particles of food that the body needs, it becomes leaky, where lots of things are passing through, larger food particles that should not be passing through yet are passing through. And this creates an overall inflammation, can even cause water retention and swelling. And this inflammation is going to be linked to inflammation in the brain and things like depression and other mood disorders. So how do we repair the intestinal wall? First of all, we're going to need to take away the things that are causing the irritation in the first place. So you're going to need to take out the foods that they're having sensitivities to. You're going to need to take charcoal for when they do have a sensitivity to reduce the inflammation. This is activated charcoal. They can take tablets, 1 or 2 tablets. You can take it in the evening or whenever you notice that they're eating a food or have had some type of reaction to a food. It'll just bind that all up. So eliminating the source of the irritation and inflammation is going to be essential, but then to repair, you can use 2 substances, L-glutamine and MCT oil. Both of those are very effective at repairing the intestinal wall and getting it back to a place where it's, it has integrity, it's functioning the way it's supposed to function. It's really going to reduce the inflammation and the irritation, the ongoing irritation of the nervous system and the intestines. So there you have it. You've got the 3 things that we talked about today: the food sensitivities, the gut motility, and then repairing the intestinal wall. I look forward to any comments and shared experiences that you have had with digestive issues in terms of attachment issues and either yourself or working with your children.